Well, news this week of approval within the European Union of Ticagrelor, which will go under the brand name of Brilique, for the use in acute coronary syndrome patients. This agent, Ticagrelor, has been studied in several trials, but the phase 3 trial was the PLATO trial. I was involved in that one, led by Lars Valentin and co-chair Robert Harrington at Duke, where this agent was compared to clopidogrel for patients across the spectrum of acute coronary syndrome patients, including unstable angina, non-ST elevation MI patients, and ST elevation MI patients treated with primary PCI. The comparison was of Ticagrelor given as a 180 milligram loading dose, followed by 90 milligrams twice a day, versus clopidogrel as either a 300 or 600 milligram loading dose, depending on the investigator, and the standard 75 milligrams a day. What was seen in the trial over a 1-year period was a 16% reduction in cardiovascular death, MI, or stroke, with the curves widening over that year's time period. Of the components, both cardiovascular death and myocardial infarction were each individually reduced, with cardiovascular death being more than about a 20% reduction, statistically significant. And that, of course, is one distinguishing feature from high-dose clopidogrel as tested in current OASIS 7, or prasugrel tested in PCI patients in the Triton TIMI 38 study. And total mortality was also significantly reduced. Interestingly, within the PLATO trial with Ticagrelor, there was not an increase in overall risk of bleeding as defined within the trial. There was a higher risk of non-CABG related bleeding, but then a little bit less CABG related bleeding, so that the total was not increased. There was also a reduction in stent thrombosis over time with Ticagrelor compared with clopidogrel. And so this has been approved for use in the ACS patients within the EU, although it won't yet be available until final negotiations with health insurance authorities in the various countries are carried out. As such, another option for ACS patients to further improve outcomes. I'm Chris Cannon for CardioSource Video News.